combination.
Okay.
Yeah.
Okay.
Your name.
So my name is Dr. Safiyya Shabazz. I'm a board certified family physician in Philadelphia, where I have a private practice, and I also serve as president of the Medical Society of Eastern Pennsylvania, the Greater Philadelphia affiliate of the National Medical Association.
Awesome. Dr. Shabazz, can you tell us just a brief little story about how and why you became a doctor?
Well, I've always had an interest in the sciences. I decided to pursue a degree in chemical engineering as an undergrad because I was not sure that I wanted to be a physician, but I learned in that process that chemical engineers can go into any field, whether that's business, law, or medicine, and the pre-medical requirements were mostly included. So after working for 2 years in a consumer health company, I decided I was going to apply to medical school. So that's what I did. I initially set out thinking that I wanted to be a dermatologist because that was the area that I was working in out of college. And then I thought, well, maybe a cardiologist, because we learned a lot about fluid mechanics and chemical engineering. But as I got more into the study of medicine and understanding people's health, what seemed most logical to me was to help people get to their health problems or the root of their problems earlier in the process, and that's through primary care.
Wow, so you deal with preventative medicine. You know, you look at it from that point of view. So what are some things that you think the everyday person may be missing out on that they need to do in order to prevent some of the conditions that they later see in life?
Every day I have conversations with people about their health habits, their weight in particular, and I notice that without exception, each of those people will start to tell me about their plans to begin exercising, et cetera. But what I think that most people miss is the importance of nutrition, the type of things that you put in the body. If you think of the body as a very efficient chemical plant, you have to have the right raw materials that you're putting into the chemical plant in order to get the production that you want from the chemical plant, which is the human body. And this body does amazing things, but it needs the right materials. It's that, of course, getting adequate physical activity, having the right types of stress management tools to manage that aspect, to get proper sleep. Even things like having good relationships with other people and with yourself. These are all things that play a role in your health and in the prevention of disease. And when you have illnesses, how to optimally manage it so that you can still live a long and healthy life.
Wow. You talked about stress. How important, stress management, how important is that in our health?
Well, of course, everyone has stress.
Yeah.
Things are going to continue to happen. Bad things happened last week. Some will happen today. There'll be more tomorrow. But learning how to control the effect that that has on your body and on your health is what I mean when I say stress management. So exercise can be one of those things that people use to help manage stress. Sometimes it's skills in life skills, planning. Some people are always stressed because they don't know how to manage money. So they need to learn how to manage those things. Some people are always stressed because they don't know how to parent or they don't know how to be in a relationship with a significant other. So there are multiple layers of that. I'm not an expert in all of it, but what I do know is that the brain is command central. And when you have upset in the mind, then command central starts sending abnormal signals to other parts of your body. You can have physical problems that develop as a result of chronic stress. We know, we're starting to understand more about the biochemical pathway that leads to that. But many times I'll be talking to people who are experiencing all these different physical symptoms throughout their body. And maybe I could say it better or work on my bedside manner skills. But when someone has everything wrong to them, known to man, and they don't want to address the stress, I'm like, okay, either we're calling an undertaker because you have so many problems wrong with you. Clearly death is impending, or you need to handle Command Central because it's making you have dysfunction in your body, or either how your body is perceiving it's relatively normal functions. And sometimes people like that tough love approach. Other times people feel like, nope, I want every test known to man because I'm not stressed. I was picking up pieces of brain at 9/11. I can handle stress just fine. I'm like, okay. Either you're have antisocial personality disorder where regular things don't bother you, you're not emotionally affected by anything, or just regular life, the things we hear about, whether it's trauma, pain, watching the news. I was watching the news, looking for a particular segment to come on a few months ago. And by the time I got to the end of the broadcast, I was depressed. I felt stressed. I felt anxious. And we're exposed to that every day. And you do have to limit your intake. You need a little stress, just like you need a little exercise. You don't want to shield yourself from the problems of the world because then you aren't even triggered enough to get up and do something about it. But chronic stress, unrelenting, without any type of outlet is bad for all of us.
So you see patients week in, week out. What would you say are a few things that would make patients be better patients, better health advocates for themselves? Like when we show up to our appointments, what would make it better so that we all come out with better health outcomes?
I think that now this might be my bias as an engineer. I like to have some data. So if you come prepared to your appointments with some level of tracking of what's been going on with you, whether that's if you're following up about your blood pressure, it's very helpful if you have a log of what your readings have been at home, because many people, for instance, will come into a physician's office and the blood pressure might be running a little higher, or they forgot their medication that day. So having some data, things that you've been tracking yourself, managing yourself, your blood sugar, weight, that makes it a lot easier for us to make decisions about what needs to be done when you come for your appointments. I think also just more generally, having a plan for the visit. Many times it can be difficult, especially for someone to access primary care, where the list of problems that someone wants to address that day starts to grow because you've waited a long time for that one-on-one time. But it can be very difficult to manage 5, 6, 7, 8 different problems in one sitting. So having a regular cadence of follow-up can be helpful so that you don't have to feel like you need to get it all out in one visit and just focus on a couple of key things for each visit. So those might be some good tips to help someone to be a better patient.
Mm-hmm. Okay, last question. You are an incredible Black female physician, and there are young viewers out there, a young lady possibly, who wants to follow in those same footsteps. What would you tell her? Or what would you even tell your younger self?
I would tell my younger self to seek more mentors. I went into medicine relatively blind. I'm a child of 2 parents. We had serious illnesses. My mother didn't see her 41st birthday because she suffered from CML leukemia. And my father, he passed away from complications of diabetes. He had congestive heart failure. So that was my experience, being a child, being in those environments where you're a family member and your loved one is hospitalized or seriously ill. And in the case of my father with diabetes, I didn't know that certain things I can think back on through the years were signs of his condition not being well controlled. And I didn't know certain basic things, that diabetes can be serious. Whether or not someone requires injections is not an indication of how serious the condition is. And having more exposure, having more people in my field of view who are actually on the other side of things, not just as patients. I think most Black people have tons of experience on the other end, where you're the person seeking care or the family seeking care. But I would have liked to have more mentors, not only so that I had some idea of what I was getting into in terms of medicine, but so that I could see a broad view of what a medical career can look like. I think we're learning now that it's not just one thing. I can do a lot of good one-on-one with patients in the exam room. I can do a lot of good with people if I were to pursue a medical career in industry or in policy or in education even. There are a lot of ways that we can make a difference. I think I would have also gotten more business skills, because I think that that is part of what is happening to the medical community, why so many people are looking to get out of the patient care. Unfortunately, we were so busy taking care of the patients that the people who make the rules, that run the businesses, they created an environment where taking care of the patients is one of the worst jobs in healthcare, which for the Black community, that's a terrible thing, because we need people in the trenches actually providing that care. But it has to be something that, you know, a very smart person would choose to do it, not just because they're altruistic and doesn't mind falling on their sword, but because you can serve and earn and have a quality of life, and your family can be taken care of as well as you're taking care of other people. So I think if more of us had some of those business skills, then the work environment would be better.
Great.
Yeah.
Well, thank you so much.
Thank
You
you.
heard it here first at the NMA 2023 convention. Dr. Shabazz, thank you so much.
Thank you.
You have been a blessing to us.
Awesome.